I've been in several car accidents.
Okay, how many?
4.
4 car accidents, okay.
And then I've, had issues with my back, neck.
What's going on?
This has been going on for a good 5-7 years.
5-7 years.
Mhm.
Okay.
I've had physical therapy,
Yeah.
a lot of
Physical therapy,
lots of massages.
massage, physical therapy. Turn and so look at her elbow. Look at this. So she's not trying to use her core muscle. She's using her elbow and her hand. How much pain from 0 to 10?
Actually, it's not real bad right now. I don't know why, but it's not.
People feel better when they see me.
Yeah, that's probably why. It usually is how it is, but it's about a 7.
7.
Okay. Well, right there is a big difference.
You're moving faster. Did you notice before she was like on her elbow and her wrist?
I've never been able to sit up like that
For how long?
since January.
Okay. That's
Ever
beautiful.
sat
That's
up
good.
Like that. I'm gonna
Yeah.
cry.
Yeah, it's awesome.
Yeah.
Yeah, thank you. What do you think about the treatment? You had PT before,
You know,
you had massage.
I've
so-
had everything before and I've never been able to sit up. Even
Yeah.
after a massage,
Yeah.
it takes me a long time to get up off
Yeah,
the
it does
table.
not break the scar tissue.
Mhm.
Yeah, yeah.
Thank you.
Yeah, awesome.
Tears.
Yeah.
Yeah, I
Yeah.
know. That was
Yeah.
amazing. Right
Awesome.
there.
I'm glad you're feeling better.
Thank you
Yeah, well,
so much.
glad it's
Okay.
working. Awesome. But this is a month follow up. You're fast.
And before, when I did this, I could feel everything in there kind of shifting around.
Yeah. Uh-huh.
And I was like, oh no, I don't want to get up.
Uh-huh.
And I could not do
Wow, that's so fast compared to the first time.
I could
That's
not
beautiful.
get up at all. And
That's
I mean,
fantastic.
I just sit right up. It's
Yeah,
wonderful.
that's
You have no idea.
awesome.
I thank you so much for that.
Thank you. So, what do you think about ASTR treatment?
I think it's well worth it. Anybody should, if they're having problems, come get it done.
Yeah,
Yes,
awesome.
give it a try because it's well worth it.
Yeah.
Been having really bad back pain from this down.
So, tell me how long this has been going on.
2 to 3 months, maybe.
Okay. So, how did you hurt?
I woke up one day and one little patch was numb.
Mm-hmm.
Then I stayed the night at my sister's house, slept
Okay.
in my niece's bed, and then it got worse the next day. So
Is it worse on the left or right or both?
probably my left.
Your left side. Do you feel it like where is exactly? Can you show me here?
Right here,
Right here.
yeah,
Okay.
down, and then it
and
goes all the way around.
so it goes around to front or stops here?
It goes around to the front.
All the way in the front. So you're right in there. 10 is emergency room.
Probably it's like 8.5, 9.
Okay.
It's very irritating.
So is that pain constant or comes and goes?
Absolutely, all the time.
All the time. So for the last 2 to 3 months, you've been having constant pain, 8 or 9 out of 10.
Yes.
What kind of pain? Is it sharp, dull, aching?
It's a numbing, tingly, burning.
Mhm.
I don't know how to describe it. When your feet
Okay.
falls asleep, thousands of needles.
Okay. How that feel?
Oh,
0 to 10?
probably 6.
Okay. Backward.
That's like an 8.5.
So bending forward, that relieve your symptoms a little bit, yeah?
Kind of.
Yeah. Twist to the
It's
left.
mainly on this side. I don't know.
Relieve it or aggravate it?
Aggravated.
forward, backward, and twist, and then, oh wow, look at that. Did you get the whole thing?
Yep.
Oh, you're going down further now.
That felt good.
Are you trying to show off?
No, I just haven't been able to do that
That's
forever.
good. That's nice. Look at that. How's that? Oh, you're going further. Wow, you're really
Oh
flexible.
man, that felt good.
So turn left and right. And you're moving faster now.
Yeah.
Side bend.
Feels like it's not so like
Mm-hmm.
tense.
Mm-hmm.
Don't feel so tense.
Yeah, the muscle is
Oh, that
spasming,
felt
yeah.
great.
So do you feel any pain or it's gone?
I don't feel any pain at all.
Those bands, this.
Yeah,
front,
just-
yeah. So yeah, just move around and tell me how's that.
That's great.
Yeah. So what do you think about the ASTR treatment? Just working on it for
I
a few
loved it.
minutes.
My low back,
Uh-huh.
sciatic. I have scar tissue buildup,
Mm-hmm.
and it's from the sciatic up toward the mid torso.
Mid-torso, so you feel it for in the performance in the buttock area.
Yes, from
On-
the falls that I've had.
Oh.
I've had like 3 falls
3 falls.
within the last year,
Okay.
from actually starting in 2016, May
Uh-huh.
of 2016.
Sure. Uh-huh. Okay, we are in 2018, January 2018. Okay.
So a year ago, this past
Yeah,
January,
okay, mhm.
I slipped on concrete steps again.
And you landed
And
on
again, I landed on the right. No energy at the end of the day from 4 o'clock on. It's just that I'm wiped out.
because you're pain.
Yes.
Because you're pain. Now it's like almost the 1:30.
Yeah.
What kind of treatment you had before?
So before the treatments that I had were, I started off with a great deal of massage therapy. to
Massage
help
therapy. You had
muscle.
massage. What
And
else?
chiropractic.
You had chiropractor.
Yeah, I was seeing him 3 times a week, and we were doing physical therapy.
Uh-huh. You did physical
Graston,
therapy, Graston. Okay.
decompression neck, and
Okay,
low back decompression, and massage therapy,
Okay,
and
s-
chiropractic adjustments. And
So-
I
so-
do, and I feel it here.
Okay. 0 to 10. How much?
Right now it's a 7. I just got up off that table.
7.
It's
Sorry.
sharp. Now it's
Sharp pain.
yeah.
Okay. Sorry about that. So with your
So both legs, no pain. I don't feel any pain. It's actually feeling good because it's
going
stretching.
down. Okay.
Yeah.
Okay. Come back up.
Okay. So right about here is where I'm feeling the pain.
Mark it in your legs. Okay.
Okay.
Okay. By your knee. Okay.
Yeah.
Coming up. How much from 0 to 10?
Right here.
How much?
A 5 on the right. Okay, on both sides right now.
So that's
It's
when
like
you
a
come
4.
back. When you come back.
Yeah.
Yes.
When I come back.
Let's twist to the left and right and see how you're doing.
Okay.
How's that? It's
So-
you're really tight.
I'm feeling tightness on the left back and the right neck.
Okay.
And then over here, I feel it on the right neck. And still again on the left side.
Okay. So before you had pain coming back. So let's
Right,
see.
right.
Okay. Look how fast you're going down.
Wow.
Look at that. Beautiful. And coming up, you're coming faster.
Wow.
How's
yeah.
that?
No pain.
Let's turn left and right. Your trunk. Left and
Oh,
right.
the trunk.
Yeah.
Okay, I do feel a little bit, not nearly as much. I think I feel like 20% versus 100% pain. on this side.
Oh, okay. So where do you feel it? Like on that side?
Yeah.
Okay. This is
And funny enough, it's up higher where we didn't
where we
hit
did
it.
not work.
Yeah, like the rhomboids.
Yeah. So we're gonna do that later. We did not release.
Okay.
And you will start to feel, like compare normal to abnormal. But because you did not have this work before, we're gonna work on a lot of areas to make everything balanced.
Yeah, I see.
Does that make sense?
Mm-hmm.
Because now with loosen this, your brain starts to compare, wow, this is tight.
Yeah,
You did not notice that because that was
worse.
pain.
Yeah.
But now this is a good side and that's the bad side.
Yeah.
So, how's that?
Feels great.
And other side?
Yeah.
Okay, let's walk back and forth and tell me how you feel walking. And back. Okay. So any symptoms or you good?
No, I'm good.
All right. So what do you think about ASTR treatment?
I love it.
Thank you. Thank you.